Hello, my name is Natalia Rodriguez and I am a member of the Informa team, to which I contribute in my capacity as a researcher in the field of interpreting studies. In my view, this project is important because it increases the visibility of a very specific type of interpreter-mediated events, assessments under the Mental Health Act, and by looking specifically into the uniqueness of these assessments, we can then get a better idea of, for example, how interpreters can best adapt to this context in order to ensure successful communication between all parties. Also, the specific challenges, but also learning opportunities when it comes to assessing someone who's linguistically and culturally diverse. And finally, find out more about the link between conceptions around mental health and language. So hopefully by learning more about all this, we'll be able to bring closer together the fields of interpreting and social care research.
Hello, my name is Dr. Rebecca Tipton, and I'm a co-investigator on the Informa project. This project is important for several reasons. Firstly, I think it has excellent potential to make lasting change to AMP and interpreter practice, and to move language and communication issues up the agenda in social care. Secondly, this project is an example of cross-disciplinary research with multilingualism at its heart. Not only are we interested in multilingual questions in adult social care, but multilingualism forms part of our research process as well. I'm excited that this project will hopefully serve as a model to other research groups in the future wanting to place emphasis on multilingualism in research.
Hello, I'm Sarah Vickery and I'm a member of the project team. My role within that project team is to advise on all things to do with the approved mental health professional practice and the kind of legal background. I also am responsible for chairing the advisory group, which is a group that's made up of people who bring their own expertise to the project and are able to bring their advice according to how they feel the project's going and where it may want to go, as it were. The reason I'm very interested in being involved in this project is literally to do with the practice of approved mental health professionals, which is my own professional background, and particularly the phrase under the legislation, which is to interview in a suitable manner. Because clearly communication is at the heart of that. So to have the opportunity to be involved in a project which enables best practice in that is hugely important to me, and I know it will be to fellow practitioners and, of course, at the heart of it, people who may be subject to that detention.
Hi, my name is Martin Stevens. I'm a Senior Research Fellow for the NIHR Policy Research Unit on Health and Social Care Workforce. And I'm on the advisory group for this study. As well as lots of research on social care, we've recently completed research on the workforce around approved mental health professionals and why there are shortages and how to overcome them, as well as some about to publish research on the availability of Section 12 doctors for mental health act assessments. I think the Informa study is really important because mental health act assessments are such crucial moments where decisions about liberty are taken. So good communication is essential, and exploring how AMPs and interpreters can work for a mental health assessment will be really valuable.
Hello, my name is Nahed Arafat. I'm sitting on the advisory group and I'm bringing my expertise and experience to the project, both as a mental health worker and a professional interpreter. I believe this project is of immense importance for both interpreters and mental health workers because interpreters often voice their concerns about the challenges they face when they carry out a Mental Health Act assessment, and they are always looking for a continuous training to improve their performance in such settings. I also believe that it is going to be of immense value for approved mental health professionals and mental health professionals in general, because they also wanted to learn more about appropriate ways of involving interpreters in such a difficult situations.